Greetings, my name is Ruby Steele and I'm the Tribal Administrator for the Ketchikan Indian Community. My job is to work with the department directors and managers to see that the Tribal Council strategic vision is fulfilled. I'd like to inform you of the 3 goals of the strategic plan. Number 1 is to implement a robust communication and public relations plan for the tribe. To achieve this goal, I will be working closely with the communications manager and tribal council to implement a communications work group. The communications work group will research and collect information for all programs and departments in the organization to maximize our audience reach and communication channels. Number 2 is to create an architectural plan for a tribal campus with rendering. A vision for a tribal campus will be fulfilled by collaborating with the facilities management director and the tribal council to determine what the future vision is for a tribal campus. We will begin by hiring a consultant to conduct a feasibility study to help determine what projects can be completed within a timely manner. Upon completion of the study will be shown to various tiers of the community, and the tribal council and staff will be trained to fully understand all aspects of the project. During the process, we will be able to determine any potential problems and if the project is viable. At this point, the schematic design and the feasibility study will be presented to the tribal council for them to approve and determine if the project will move forward. Number 3 is to create a data collection strategy that is consistent throughout KIC to analyze the needs of tribal citizens. We will work with the staff to create a data collection work group to determine data management for all programs and departments within the organization. This group will analyze and identify the capacity of staff to gather data and assess the needs of staff training for data collection. The group will also help implement and design a project plan design. The administration department delivers essential services, resources, and support to the group of tribal citizens, staff members, and tribal council. The department was given 1 goal during the strategic planning process: to set up a permanent location and filing system for tribal-wide records and archives. The permanent location must be safe and fireproof. For a filing system, the administration team will establish a record management work group. The group will consist of a representative from each department and the communications manager. The group will develop a work plan for the records management to help streamline goals, objectives, and to aid the establishment of team responsibilities and set project timelines. I am excited to join the Ketchikan Indian Community and look forward to fostering positive change in the community. Thank you.
Hello, my name is Donna Frank. I'm the Controller and Interim Chief Financial Officer for the Ketchikan Indian Community. I am a Lutic and a proud member of the Ketchikan Indian Community. In order to grow the future of our tribe, we need to create a sound financial system to build healthy programs that meet the needs of our tribal members and the future generations. One of the top objectives for the finance department is to develop and implement an easy-to-read and usable monthly financial report. Included in this task is training for the Tribal Council on interpreting the reports and how to use the data to make sound business decisions. These up-to-date reports will be presented to the Tribal Council on a monthly basis. Funding is crucial to the expansion of our programs. A clean audit will qualify us as a low-risk auditee, allowing us to capitalize on available funding opportunities. This designation also is a sign of a competent finance department, which lending institutions require. We can reach this goal in part by creating a quarterly reconciliation process of our grants and general ledger accounts. These tasks must be accompanied by policies and procedures that will maintain efficient operations. Thank you for your interest in the future of KIC.
Hello everybody, my name is Bill Abbott. I am Tlingit, born and raised in Juneau. I am Mushkitan, Eagle Shark. So I'll be going over our human resources HR priorities. So as you may well know, the HR department works closely with our people, and we constantly strive to provide fair workplace environment. We want our employees to be successful and provide high quality professional services to promote and improve employment at KIC. The HR department works with all applicants and ensures that we do our part to instill KIC tribal member American Indian Alaska Native hiring preferences for our vacancies. And over 65% of our staff right now are KIC tribal members. Nearly 75% of our staff is American Indian and KIC tribal membership. Our HR team is working with three main strategic priorities, which include: number one, establish an annual review process for Ordinance 8 HR employment policies and employee handbook. Number two is to establish an enhanced rewards, recognition, and retention program. And also the third one is create a company-wide succession plan, training and development for employees. So for the coming year in 2023, the HR department will focus on the first two priorities. HR manual, because it's been a priority for a while with KIC. And then for priority two, employee retention programs. We need to get some baseline programs in order to work on succession planning, which is the third priority. Regarding the HR manual, we have a few steps to work with, including providing drafts to leadership at KIC to receive input and update information. We'll also be providing it to the full tribal council so they have an opportunity to review the document as well. And then from there, we'll have workshops with the tribal council's policy committee. And we hope to have approval of the HR manual by either December or early in January with the tribal council's regular meeting. So once the HR manual is approved, HR will have to distribute the HR manual to all employees, provide them an opportunity to review the HR manual and sign off on the acknowledgement form. And then we'll also work on a supervisory orientation with all leadership so that they are provided an opportunity to review all the policies, and we'll go through in-house protocols as well. With HR Priority 2, which is to establish an enhanced rewards recognition and retention program, the HR team will brainstorm and develop programs during the year, seeking input from leadership and staff, and then looking at the budgetary factors as well with those programs that are developed for consideration. HR has been brainstorming ideas throughout this fall, and some of those include, under the rewards portion, an annual employee awards program, a company that's called Access Perks that provides discounts programs for employees. For our recognition side of the HR priorities, we'll be looking to review our employee longevity program and then also improve upon our employee recognition with new hires and announcements so that we continue to improve everybody's awareness of who's starting with KIC. The third item of HR priority 2 is retention. And so some of the things we've been looking at and discussing is items such as paid time off, our PTO program, to see about improving and providing more leave opportunities for employees. That's been brought up by several candidates in the last few months. Looking to enhance our employee training, as that is a part of our third priority for succession planning. So we're looking to invest training resources with employees and provide opportunities for personal and professional growth. Another item that we're looking at is to standardize our health insurance premiums. Right now we follow the Federal Employee Health Benefits Program and use their information as far as a premium share. So we're looking to standardize or improve that premium share to, for example, a 75% employer payment and 25% employee premium share. We're also looking to implement career ladder, encouraging through multiple levels of job description titles, a level 1, level 2, or level 3, for example, so we can maintain some longevity in the same positions for our employees and provide growth in their wages. Another opportunity and possible idea is to look at an employee referral program. One of the challenges we've had lately is recruiting individuals, and so looking at employee referrals will provide opportunity for our employees to encourage their friends and people that they know in the fields to apply for our positions, and we'd be able to provide opportunity for them to be rewarded for that. And as some people may know, KIC approved our compensation program in July. We implemented that in August, and so that's been a great tool to market and inform tribal members and Ketchikan community members that our minimum wage is $20 an hour. So the HR team looks forward to achieving all 3 of the priorities in partnership with our leadership team and staff throughout the year. Thank you.
Hi, my name is Lynn Kwan, and I'm the Director of Social Services here at Ketchikan Indian Community, and I've worked for the tribe for 26 years this October. I love my job, and I couldn't imagine myself doing anything else. The first house post that we are addressing with our strategic plan this year is House Post 2, Build a Healthy Tribe and Citizens. We plan to improve and expand the elder care services. We will provide elder care staff with advanced training to provide services that will increase elders' independence, health, and overall sense of well-being. We will do this by identifying best practices and current trainings that are available in a variety of ways to meet the needs of the program and reduce the burden on the program services whenever possible. The training will not reduce services to program participants, since many trainings are now available through webinars and online opportunities. NRC-NAA, the National Native Elder Caregiver Curriculum, and the National Indigenous Elder Justice Initiatives are just 2 of the best practice curriculums available. We will have staff share what they have learned and teach back following trainings to make the most of every training opportunity. We will implement a process to measure the impact of trainings and the improvement of services by reaching out to tribal members and asking how they feel about the services they are receiving and how we can continue to improve. We will develop a multidisciplinary team to provide comprehensive case management for elders. With successful collaboration, the Elder Program Coordinator and clinic staff, we will provide in-home visits for elders that are often unable to get into the clinic for regular checkups. Home visits will improve the quality of life for many elders and reduce the need for emergency care due to poorly managed health concerns. We will expand the Elders Program menu to include many traditional indigenous foods while exploring promising practices and nutritional guidelines, consulting with a certified dietitian and a nutritionist. We believe that our traditional foods not only nourish the body, but also the soul. The second house post that we are addressing with our strategic plan this year is House Post 3, Exercise Our Sovereignty. We plan to do this by increasing the capacity of the tribe to respond to ICWA cases and improve outcomes in child in need of aid cases to remain with tribal families. We will provide case management to improve the outcomes for children in foster care due to increasing the accountability between agencies and parents. Our intention is to reduce out-of-home placements and increase speedy reunification. The family case manager staff will be able to assist families in the process of developing a meaningful case plan that will lead to bringing their children home. In the case this is not possible, we will work diligently with the family to keep the children close in guardianship with extended family or tribal members. We will provide comprehensive Child Welfare Academy skills training related to ICWA law and qualified expert witness training for all Indian Child Welfare Program staff. We will provide Child First forensic interviewing training at Child Welfare Academy for all ICWA program staff as well. We will work with the Tribal Council to identify cultural, qualified expert witnesses and identify best practice trainings to ensure the tribe is represented on each ICWA case. We will develop a Safe Visit, Safe Exchange program. There are currently a lack of services for families in our community when there are visitations that are requiring supervision. Our ICWA and Victim Services program will create a program that will promote family preservation and the parent-child bond and improve the chances for reunification. We believe that the visits should be in a home-like setting and will include security to increase safety to non-offending parents and to their children. We know that elders are natural mentors and keepers of great historical knowledge for the tribe. We intend to invite elders to help us by participating in a formalized mentorship program that will offer parents the unique opportunity to learn and practice traditional parenting skills and build relationships with each other who are at risk of or are involved with the state child welfare system. Thank you.
Hello, my name is Sonia Scan. I'm the director of the Education and Training Department, and I want to talk to you about our house posts that the Tribal Council have put in place as the foundation for what we are doing and how important they are. We strive to put them in use every day in our Education and Training Department, and we have one goal that has been deemed our most impactful goal, and that has been set by our Tribal Council. The first goal would be to build an education building that will be up by the high school and the UAS Ketchikan campus. The building will be for language offices, classrooms, tribal scholars classrooms, native arts classrooms, our after-school program. And this building will be a sense of place that reflects the culture of the tribe when looking at the building and what is going on. And we want people to walk in and know who we are. We believe that serving all of our tribal members from the youngest to the oldest is the most important thing that we can do. Our number one most impactful goal is one that would bring us to another level of service. By creating a cultural education building, it will give us a space for learning. Having a building by the high school will offer our classes to more people. We can open up the availability for permanent classrooms to be set up for all ages. We want a design that will not only house our language and native arts, but can be used for a pre-K through 12 option for school. We know we all learn differently, and we are all looking for ways to reach our second goal, which is addressing the dropout rate of our students by creating a focused program to address the dropout rate and to develop and implement a student success program. By having a space for learning, we will be able to not only teach the standards that are given to us by the state, but we will be able to include language and culture in all that we do. We envision the classrooms to be a place that includes teaching students how to live off the abundant resources of our land, as well as to focus on the future of what is available for lifelong learning, including CTE training, college prep, life skills, art, language, as well as preparing the students for employment and or college. Right now at the district, we have about 90 youth who are not on track to graduate. Out of that 90, over 60 are identified as tribal youth. We want to be able to have a place where those youth not only can earn credits they need to graduate, but where they can thrive. We believe that having a space for youth where they feel connected and heard will give them the ability to do just that. We want each and every person that walks in our door to feel welcomed and to receive the help that we can provide. With the council naming our top goal as helping our youth, it shows their investment in the tribe's future. Without our future generations, we are lost. It is our belief that Hashuka, which can be translated as our future generations that come from our ancestors, is so important. By giving this goal top priority, it shows the tribe's leadership is investing in our future and yours. We know that every decision is made mindfully and with care for the health and welfare 7 generations and beyond. Thank you.
My name is Myrna Cheney, and I am KIC Housing Director. I've been the director for 3 years now and been with the Housing Department for 5. Thank you. KIC is currently working on 2 strategic objectives. The first top priority strategic objective is development road access to Lot 7 subdivision. The KIC Housing Department's high priority is the development of the property Lot 7. The property is located at the top of Jackson Street and is next to existing KIC housing. Lot 7 is about 12 acres of uncleared land, and the goal is to offer affordable housing. And this affordable housing is for tribal members on this property. KIC Housing has previously used transportation funds for the roadway development and design and is ready to re-engage to take the development to the next level. KIC Housing will continue to apply for grants and establish partnerships to push this project to completion. KIC Housing Department is also working on applying for ICBDG and other funds for unmet needs and focusing on multi-generational housing and homelessness. The KIC Housing Department is focusing on increasing our housing stock and programs specifically focusing on the unsheltered homeless population and multi-generational housing. Staff is preparing a survey to send out to tribal members to collect data focusing on unmet housing needs, as well as work with other tribes for best practices. KIC Housing will acquire property and utilize existing property for future housing projects. KIC is actively applying for grants, specifically unmatched grants, to continue our efforts to increase affordable housing in our communities. Staff will also reevaluate and update the transit plan to fit our tribal needs. Ha'a. Thank you.
Hello, I'm Tony Gallegos. I'm the Cultural Resources Director with the Ketchikan Indian Community. Let me tell you a little bit about our department. Basically, we have 3 major program areas in no particular order. We have the Cultural Heritage Program, and we have a Natural Resource Program area, and we have an Environmental Protection Program area. All 3 of those work together to address a lot of the issues and concerns for the tribal council and the members of the community. So let me tell you about a couple of our key priorities. One of them is protecting our access to our natural resources. Our fish, our ability to fish, hunt, and gather are a big concern to the tribe. One of the key areas that we're trying to address this year is our effort to try to regain a rural status for the community. And this will open up many opportunities for us to utilize the subsistence regulations to gather and have additional access to those traditional foods that we all desire. We've got other efforts working with regulatory enhancement and developing a traditional foods program in that area as well. The other priority that's been identified that I'll talk about is our trying to exercise our cultural heritage more so. And we are trying to develop a sacred site management program. We've submitted a grant recently, and we are working towards growing in that area about using our ability to protect and manage the sacred sites all around our traditional territory. I'm looking forward to our ability to work in that area. The Indigenous Guardians Program is one means we're going to be using to try to increase our ability in that area. And we just have applied for a Native Act grant to help us in that area as well. So excited about the future and what we can do to exercise our authority and sovereignty in those areas. If you have questions about these programs or any of the programs in our department, please stop by our booth and talk with our staff. Thank you very much.
Good afternoon. My name is Richard Darrington. I've had the pleasure of being the Information Technologies Director for KIC for the last 11 years. I wanted to take a brief moment today to talk about the IT department's strategic goals in the upcoming year. With the growing amount of data generated by all the tribe's many programs, it has become necessary to implement a program that will allow each department to build strong, secure, functional databases and will allow for the sharing of specific data between departments. We are working to reduce the amount of times tribal members are asked to provide the same information when receiving services from multiple KIC departments. After researching several different programs, we have settled on one tribe. We have begun the process of installing the program and testing the database capabilities with the COVID Relief Department and plan to spread it out to the other departments within the next year. Another priority for 2023 is the creation of an IT internship program where we can begin to train the next generation of IT professionals at KIC. We will be looking to train tribal youth who are either in or just out of school. We'll be working with the school district as well as the tribal youth department to find suitable candidates. We will be planning on a 6-month internship that will cover most of the basic IT skills required to find a job. If you or someone you know is interested in this opportunity, please keep an eye out for an official announcement early next year. Currently, the IT department also oversees security, and the security department has grown over the last few years, and we look forward to further developing the department with new job descriptions and new duties. One of the main goals of the new security department will be the creation of a safety and security program and training plan that will ensure the safety of all KIC citizens and employees, as well as all of KIC's many properties. This will allow for training of all security staff, as well as the training for KIC security personnel. Thank you.
Hello, I'm Jim Gillian. I'm the KIC Facility Superintendent for all our facilities. I'm here to present my house post number 2, which is building a healthy tribe and citizens. Recently, the Tribal Council actually changed our name from the Maintenance Department to Facilities Management Department, which we're very happy to have a new name. So we are the Facilities Management Department. Our department's number 1 priority is to build a facilities management and receiving building. This needs to be accomplished in order for our department to provide more efficient support services for our KIC community, building, and campus. Our department will accomplish this task by first identifying and purchasing property that has enough adequate square footage and space and the zoning, proper zoning needed for this new facility. To secure property for this project, we will be looking for collaboration opportunities with other KIC departments and programs, such as KIC's housing and our tribal health clinic. We will then secure an AE firm and begin our design phase for our new shop and receiving areas, as well as the associated offices needed for the staff. The housekeeping manager and housekeeping supplies will also be located at this new facility. Once the 100% design, shovel-ready for construction documents, and cost estimate are completed, KIC will then pursue and identify the funding needed for this construction project. KIC will be exploring all funding opportunities during this period, such as bank loans, BIA and IHS 105L leases, and ARPA funds, or grants. This KIC project will be then put out to bid, and we will find an AE firm that will provide services during the bidding, procurement, and permitting process, as well as services during the construction phase of this project. Once the building construction has been completed, we will relocate the facilities management staff, equipment, and supplies to this new facility. Our second priority that we have for the facilities management department is to develop a comprehensive facilities management data tracking system for our KIC property and equipment management. This task will be completed by first assessing the various facility management data software vendors that are available and decide on the best fit for our department needs and budget. We will then submit the vendors' relevant software information to our IT department for review and approval. The facilities management data tracking software system and costs would then go to our KIC tribal administrator for review and approval. The annual contract cost for the selected vendor service would also be reviewed and approved at that time. The next step would be the onboarding, uploading, and startup phase for the implementation of the new facilities management database system. This phase would also include the training of our facilities management staff. We would then need to periodically review the progress made while utilizing this new software and adjust as needed to improve our department's efficiency and accountability in the performance of our responsibilities and duties in facilities management. My name is Jim Gillian, and I thank you for your time, and I really hope the best for our tribe. Thank you.
My name is Wendy Ross. I'm the Revenue Cycle Manager, and I'm also in charge of the Patient Access Representatives. For my strategic goals, the first most impactful strategic objective for Revenue Cycle is to promote excellence and quality of care at all customer service areas to reflect cultural values, respect, increase our population, and encourage returning customers. The second most impactful strategic objective is to increase revenue across all clinics. Revenue Cycle will develop training for cultural etiquette. This will ensure that actions and communications are appropriate for the community. It will let the community know that as a Native American clinic, we respect the beliefs and traditions of the community. We will use traditional greetings with the community members in Tlingit, Haida, and Tsimshian, on the phone and in person. Providing timely responses to questions and complaints will help the department focus on the patient's needs. Increasing revenue across all clinics will ensure sustainability for the current programs offered to members and allow us to expand our services with the focus on community expectations and needs. Meeting with directors and administrators will form a collaborative environment. We can create structure, a firm foundation, and engagement for streamlining workflows. The use of best practices and conformity in clinic applications will save time and improve processes. User manuals will allow staff to find the solutions they need to resolve application issues. Periodic training focusing on areas that require improvement will increase efficiency. Conducting job skill assessments will allow the department to Conducting job skill assessments will allow the department to assess skill levels. Deficiencies can be examined at that time. Training will be provided to improve their skill sets, setting them up for success. We have brought Revenue Cycle in-house. It has already captured more revenue because the clinics belong to the community. Community members work for the clinic and have a genuine interest in the success of the programs. The goal is to create trust, improve our reputation, and be dependable to the patient population so that we can best serve the community and work toward creating a healthy tribe.
Hi, my name is Joel Jackson. I am the Health Services Administrator for Ketchikan Indian Community. I'm excited to announce the KIC Health Services Administration and Health Services overarching 3-year strategic goals. Our Tribal Health Services Administrations has 2 most impactful goals or strategies as part of House Post 4: economic self-sufficiency, growing our future and investing it in our tribe. We will do this by partnering with the University of Alaska Southeast to enhance tribal members' recruitment in nursing, behavioral health, and allied health professions. 2, providing a workplace with equitable pay and opportunities for promotion. Some recent examples of this work include renewing and updating our MOU with the University of Alaska, and of course our recent compensation survey. Our overarching plans include 3 impactful goals that support House Post 1, living our culture and infusing culture in all aspects of our operation. House Post 2, building a healthy tribe and citizens. And House Post 3, exercising our sovereignty. We will do this by, number 1, providing training and instilling positive practices and preventative measures to enhance a positive workplace culture. 2, we will adopt a foundation of systemic, patient-centered model of care that aligns with traditional Southeast tribal values. And 3, we'll collaborate with leadership and use data to identify the scope of services provided by the Tribal Health Clinic. Recent examples of this work include working with our cultural heritage partners in outreach planning efforts and inclusion and updates and efforts in all of our reports to the Advisory Health Board and the Tribal Council. I am honored to lead this long-term project to make sure that we are being proactive in keeping you healthy and also making sure we're providing the best care for you when you are not. Thank you.
Hi, my name is Dr. Andrew Zink, and I am celebrating my 1-year anniversary as the KIC Medical Director. I grew up in Michigan, in Detroit, where my parents, brother, sister, and their families still live, and I moved to Ketchikan just over 9 years ago to practice OBGYN at Peace Health. Now I'm the medical director of the clinic here, and I'm going to be talking about our 2 top strategic planning goals. The first one is adding RN case managers to our team, and the second one is making sure that we're following standards of care. Case managers are nurses who can help you navigate your care. Once you've met with a provider and come up with a plan, they can do things as small as helping make sure that you've picked up your prescription, but can also help make sure that your referrals are planned, travel is scheduled, or help you get other things that are a little bit more difficult to arrange. Standards of care are the best medical practice. We want to make sure that the entire team is on the same page. Some of this work is already being done by other departments, such as wellness, with their diabetes program. That's an example of a large program to make sure that you're receiving the best possible care. Some other things that are a little bit smaller are making sure that your vaccinations are up to date and that your cancer screenings are also up to date. This is some of the work that we'll be doing over the next few years as we review each medical issue and make sure that we're following the best medical practice. It's been an honor to serve as your medical director, and I look forward to seeing you in the clinic. When you see me in the hallways, make sure you say hello.
Gunalchish Hat Yadi. Thank you all for coming. Hi, my name is Brad Clear, and I'm the Director of Nursing at KIC Tribal Health Clinic. I'm excited to be able to present to you today 2 of our most important strategic objectives in support of 2 of the tribal house posts, which will directly impact your healthcare delivery as a tribal member at the clinic. Our overall aim through these objectives is to provide the best possible care, resulting in the best possible outcomes and experience for all that come through the doors here at KIC. Last October, we began planning for this year's strategies and developing the top ideas which would achieve our aim. Our first objective was clear. We needed to build, then retain our nursing and support staff in order to move forward towards any desired goals. The idea of a clinical ladder was born. The clinical ladder is a tool used to define and provide advancement and promotion, as well as increase staff competency and retention. Once approved and implemented, the clinical ladder will promote and encourage professional staff development with attention to Native preference. These have been identified as fundamental in building and retaining both a competent and a professional group of nurses and certified medical assistants. We are working in partnership with the Education Department, Health Administration, and Human Resources in order to secure the appropriate resources and to ensure that we have the right pathway forward. The clinical ladder is in its final stages of research and development and nearly ready for the initial submission. Approval would be followed by any necessary corrections and hopefully implementation. Our other objective is a larger collaborative work, which has already begun to flourish into the same-day medical services and in the very near future, walk-in medical services for all KIC tribal health members. The expansion of hours beyond 5 o'clock has already been completed and is in its early stages. Primary, pediatric, and same-day services are now available at KIC. This objective, however, is intended to focus on walk-in services and expand access to members bypassing their need to visit the local emergency department for urgent and non-urgent complaints, then wait for hours on end for their care. We are working around the clock with HR and administration to ensure that we have knowledgeable and dedicated staff to sustain this objective for the years to come. It is our goal and desire to see our tribe healthier and happier as we expand the access and hours for their primary and urgent medical needs. Please join us as we celebrate you and the bright future of Ketchikan's Indian Community Tribal Health Clinic. Good night.
Hi, I'm Max Kaiser. I am the pharmacy director here at KIC. I am Aliu, and I am a KIC tribal member. I'm excited to tell you about our strategic plans for the next couple years in the pharmacy. Our number one goal is to provide medications for everyone at KIC so that nobody has to get medications filled outside. We're doing that by holding pharmacy and therapeutics meetings every 2 weeks, getting medications added to formulary, and we're also looking at those of you who have been filling medications outside of KIC because your insurance only pays for a certain med that we don't have, and we're looking at getting all of those available at KIC so that everyone can get their care here. For our second strategic goal, we are planning on using our expertise as pharmacists to expand services for the tribe. Pharmacists can do a number of things for tribal members, such as manage diabetes and blood pressure through collaborative practice agreements with our medical team. This gives the medical providers more time to dig deep into your health issues and your complicated health issues, and lets the pharmacists manage the chronic issues that we have the expertise to manage. We are looking forward to bringing these services to the KIC tribe, and I believe that we can
Hello all, I'm Jessie. I'm the Wellness Manager at KIC, and today I will be talking about our two most impactful strategic objectives for the Wellness Department. For House Post 1, we will be creating an award-winning diabetes treatment and prevention program. To do this, we will maintain accreditation through the Diabetes Education Accreditation Program. Accreditation demonstrates the high quality of the diabetes treatment and prevention program and our services. We will pursue hiring a registered dietitian nutritionist to provide critical nutrition services. As food and nutrition experts, RDNs help patients develop individualized meal plans, monitor patient-centered nutrition interventions to alleviate and prevent disease. We will collaborate with the medical department to have at least one provider dedicated to patients with or at risk for diabetes. For patients living with diabetes, we will collaborate with various departments to create a team to deliver diabetes self-management education and support classes and one-on-one sessions. By teaching skills, DSMES empowers patients with diabetes to confidently make decisions about their health and how to get support when needed. For patients at risk for diabetes, we will continue to deliver our diabetes prevention program classes and one-on-one counseling sessions. Our DPP follows the CDC-approved Prevent T2 curriculum and emphasizes healthy foods, increased physical activity, and reducing stress. As needed, we will continue to host ANTHC for Diabetes Field Clinic. For House Post 2, the Wellness Department will be evaluating unmet wellness needs to strengthen health education. We will be running reports through our electronic health record reporting system to identify the most prevalent diagnoses. We will collaborate with medical and other departments to receive recommendations on the most needed health education. We will publish a wellness survey and review existing survey results. Based on our findings, we will select or develop a curriculum and lesson plans. We will advertise education classes to tribal members and the medical community. Based on participant need, we will deliver quality health education classes or one-on-one sessions. We will ensure the quality of course delivery by course surveys and participant feedback. Thank you for joining us. We look forward to working with you.
Hi, I'm Teresa Nelson, the lab manager. The lab's goal is for our patients to know to expect quality experience with each and every visit. And to accomplish this, personnel retention and recruitment are our top priorities. At KIC, we believe in growing our future and investing in our tribe. Therefore, the lab's top two strategic priorities are 1, to sustain permanent staffing members, and 2, to recruit from tribal members offering training in phlebotomy and lab sciences when needed. Our first priority, to sustain permanent staff, not only reduces expenses incurred by utilizing expensive temp agencies, but also means that you will likely see the same personnel each time you visit the lab. Hopefully, that means you will get to know the people on your healthcare team. As lab manager, meeting this particular goal is mostly on me. I know that happy, confident employees provide better care, so I will take leadership training so I can provide the tools they need to be successful. I will meet with my staff regularly, where I can express my appreciation for their hard work and listen to their valuable feedback. My goal is to create a positive work culture that develops staff effectiveness and builds morale. For our second top priority, we will recruit from tribal members. Not only will you see familiar faces in the lab, hopefully building a stronger trust with us, but we will be providing a great entry-level position for tribal members to gain skills needed for a career in healthcare. During times when we are fully staffed, we will also offer phlebotomy and lab science training. We have already begun training nurses and other allied healthcare professionals to collect samples and run tests like point-of-care COVID, strep, and pregnancy tests. These skills are great for their professional development. The lab is dedicated to providing you with consistent quality care, and we thank you for trusting us with your healthcare needs.
Good afternoon. Welcome to Strategic Planning Day. My name is Elmer Guerrero, and for the past 22 years, I have been your dental director for the Ketchikan Indian Community Tribal Health Clinic. I was born in the Philippines and emigrated to the United States when I was 5 years old, and Guerrero is translated in the Filipino language as Great Warrior. Today, I will be presenting the dental strategic priorities that were approved by the Tribal Council. The first strategic priority is called House Post 1, which is to engage the community by providing dental health outreach through health presentations. This increases our visibility to be seen as an active healthcare partner in Ketchikan. The community that we will be serving will consist of the Ketchikan School District, Klinka and Haida, and Rural Cap Head Start Centers. In addition, the dental program will also be available for health career days at the elementary, show and bar, and at the high school classes. The community will be informed through the means of a monthly newsletter, social media, and through the KIC website. For the second strategic priority, it is called House Post number 4, which is to increase the value of the dental program through in-clinic billing by the revenue cycle. This allows the program to ensure financial stability and growth. It also helps maintain control of the billing process, which increases the value and revenue of the dental department. Gnishchish, Hawa, and Doingshan. Thank you.
Hello, my name is Renee Schwartz, and I'm here today representing the Behavioral Health Department and our two most impactful strategic objectives. Our first objective is to provide culturally relevant care and service activities to those seeking healing and recovery in behavioral health. We've noticed that people come to us seeking support for their substance misuse or mental health problem, and they have no connection to their culture. They're often lonely and isolated and find refuge in drugs or alcohol. We want our members to know their culture and to find refuge in their culture. We want to connect our members to who they are, to the land they live on, and to a way of life rooted in culture. We want to bring in tribal members into our treatment groups who have walked the road of healing, who have learned to live a sober and meaningful life, so they can instill hope and tradition in the treatment groups that we offer. We want to offer education and clinical supervision to tribal members in recovery, to grow in their ability to co-facilitate and even lead our treatment groups. We want to connect members to cultural activities that bring the mind to the present moment. When we are in the present moment, the part of the brain that regulates emotions and stress becomes stronger. This is the same part of the brain that battles addiction, substance misuse, and mental health problems. Culture brings us to the present. Culture brings the mind to see the beauty of the land, air, and sea, to hear the sound of a drum, to taste the flesh of salmon or the sweetness of a berry, and to feel a peace in the heart that unfolds in the sanctuary of relationships that are safe, healing, and supportive. We want to collaborate with cultural resources and social services to link our members to these activities. Our second objective is to expand our services to youth by adding 4 additional support staff and 1 additional youth clinician. We want to train staff via education and clinical supervision to make sure they meet state certification requirements and learn that the heart of what we do is based in safe relationships. We want youth to be supported by people from their own culture, by people who know what it is they struggle with and who have shared the same struggles. We want youth to be supported in school and know they have a safe adult to turn to when emotions feel too big, when there is pressure from peers, friends, or parents, and when things may not be going well at home. We want youth to learn that there are safe and supportive adults there to help, and that safe and supportive adults and relationships are more meaningful than alcohol or drugs. And in this support, we want youth to experience trust and faith in themselves, others, and their culture, so they feel empowered to break the cycle of historical trauma.